thank you for the awesome introduction. Let me do this real quick. All right, so I'm going to talk about low back pain while sitting down and how to fix it. A lot of 99.9% of us are sitting down about 8 to 10 hours a day, especially with all these Zoom meetings. So a lot of times when this is going on is you're going to start getting low back pain because of your hip flexors. Now, the hip flexor is going to be this muscle called the psoas. So usually that little red thing that you're looking there, that's where all the stress is going to happen. Your back pain is going to come from the front, not from the back. Okay? So it's caused by adhesions and knots. Those are going to be, that's what's going to cause the muscle to get shortened and tight. So when that happens, it's going to be called what it calls lower cross syndrome, which means that the low back, your lumbar spine is going to be really close to your femur, and that's going to cause a lot of pinching on your nerve. So it's going to give you a limited range of motion. So what's going to happen is your muscles are going to be like levers. So a regular function will be right here where both muscles are pulling from equally. Now when you have a back pain and tightness, you're going to have an overactive muscle, and that muscle is going to start pulling that joint to one side, causing the other muscle to be underactive, and you're going to have a lot of tension and strain on that muscle. Okay? So a back posture, when I'm looking at someone, I'm looking at this. So when you have a back pain and like some tight psoas, your hips are going to kind of come up, and it's going to start compressing your spine and your ribs, which is going to cause a lot of dysfunctions on your muscles and your movement. So how do I fix this? Pretty easy. I start with trigger points. After trigger points, specific massages on your muscles. Then I move on to the core training to activate the underactive muscle, the weak muscle. Then we'll do some stretches and strength training to activate those core muscles. Trigger point, very simple. It's going to be like a kind of a self massage on those very tight muscles and tender muscles. And then with the core training, we're just going to activate all those muscles in here. So here's your psoas right there, right on the spine. So you can see how that's going to affect your low back and pinching your nerve. This is what it looks like when a psoas is pretty tight. Usually you're going to have one side tighter than the other side. So that's where going to be most of your pain is going to happen on that side. Okay. Strength training and core. So basically once we have everything completely loosened up, we start strengthening the weaker muscles so that you can start having decompression on your spine and also all the joints. So the way I go about this, phase one, it could be the stabilization phase. Basically, I'm activating all your muscles and making sure everything is completely aligned. Phase two, we're going to start strength training those muscles. Your muscles are kind of like, let's think about a marathon. In the beginning, you're going to be last at a marathon. Then after that, you're going to be kind of like your muscles going to start getting more active and start getting in better shape. So that's where going to be the strengthening size. We're going to be doing different exercises. And then finally, phase three, which is going to happen about 2.5-3 months. That's where we're going to be going on to optimum performance. And you're going to be super active in the best version of yourself. So basically, you know, I'm focusing right now on the low back, but everything becomes on a domino effect. So you're going to have low back pain, but you're also going to have some pains on your shoulder area, also on your knees, and also on your ankles. So I always going to start with starting from your foot and work my way up to your knees, hip, and shoulders. You know, so kind of like head, shoulders, knees, and toes. I just go with the toes, knees, hip, and shoulders, then neck. So that's how we go.
Awesome.
Any questions?
Awesome. Well, you have a bunch of questions, so we can use your extra time for
Sure.
that. Hang on, let me just stop your timer. That was a lot of information. I had no idea personally that you knew so much about the issues you've been having, correcting them. You're not just a personal trainer. You
Right.
actually can, it seems like reverse some issues. It's amazing. Okay, here we go. Let me just go to the top. a couple of questions. What kind of wrestling?
So I did professional wrestling, kind of like the WWE style Hulk Hogan deal. So this one of the reasons I became a trainer was because of that. In the beginning of my training, I dislocated my shoulder about 38 times, had a 96% reconstruction on my shoulder, and I had very, very limited motion on the shoulder. So I didn't like the way my physical therapy finished. So I became a trainer and started thinking outside the box, and I got my shoulder to where moving pretty good. So
that's a great story. Obviously,
yeah.
A lot of passion behind what you do. Awesome, love it. Okay, so that's all the wrestling questions. Let's talk about exercise. Should we be doing squats and lunges between Zoom calls?
You can. So again, when you have tight muscles, okay, if you start doing any type of squats or lunges, a lot of times those tight muscles are going to cause a lot of. That's where the pain is going to start becoming. Okay, so you have to first correct the dysfunction so that you can start doing better lunges or better squats.
That makes perfect sense. What are the best stretches to do after sitting so long? Let's assume that somebody doesn't have any issues yet. So what stretches should we be doing?
So your hip flexor are gonna go from, and I'm sorry that, well, that's pretty good. Your hip flexor are gonna be right below from the rib cage all the way down to your hip. So a really good stretch will be if you bring your leg here and then you start. There we go. So if you start like kneeling down a little bit, like kind of doing like in a lunge with your leg straight, you're going to be stretching that psoas really good, and it's going to decompress your spine the way it should be. Once you do that pretty good, then it should relieve that pressure of the sciatica nerve.
Perfect. I like that. We all just got a great tip. Okay, this might be one that is going to be longer than for Q&A, but what type of exercises do you recommend for core strengthening?
My go-to is going to be a plank, TVA activation, which is like bracing. Normally you want to strengthen your transverse abdominis, which is the very first layer of your abs. It behaves like a belt. Okay, it's gonna start, your transverse gonna start from the spine, and it's gonna go across all the way to the lower part of your hips. Now, when we're sitting down and that psoas start acting up, if that muscle is going to overstretch, so you want to get that muscle to get strengthened, so that instead of having a pelvic tilt, right, you're gonna have that nice back curve.
I like it. Okay. Is it better to sit on an exercise ball? Will that lower your back pain if somebody's having some issues?
It will in some cases because you're working a lot with balance. And, you know, like I recommend it. So it depends on what type of exercises you do on the stability ball.
Okay. Kind of following on that, are there exercises that we can do while we're sitting at our desk?
So sitting on the desk, yeah, you can probably grab a band and just, I prefer the hands going over, palm over, and then just kind of bringing it back this way. That way you can tighten up your mid trap, okay? Because a lot of times what happens when you had that back curve, like I was talking earlier, what's going to happen is that your upper body is going to go like this, okay? So you're going to have a lot of tension here on that upper trap, okay? So you want to strengthen this over here so that you can roll your shoulders back, and it'll be like sitting in a where it's supposed to be sit.
I like it. Okay, perfect. That's good for everybody to help the rest of it. Okay, back pain from cleaning. If you've been lifting heavy boxes and doing things, is it normal to have stiffness for days after that? Is there anything you can do to alleviate that?
Yeah, so those back pain, again, like basically what I was talking about on the presentation, that all comes down to that. So I would do first the trigger point, and then the core training. A lot of times when in cleaning, especially like if you do this motion, the transverse motion, what's going to happen is that your spine is going to do this deal. Okay, it's going to hyperextend. So what happens is like when inside the spine, your spine going to roll, and the fibers are going to kind of be in a circular motion, like going clockwise and counterclockwise. So when you're doing that rotation, it's going to kind of like weaken those spines, and that's where the problem is going to start happening.
Okay, thank you. You may have kind of touched on this, and I think it goes with your whole program from start to finish, but anything to help misalign hips?
Yes, it's go again with the trigger point. So it's going to be like decompression of the spine. Once you decompress the spine and the rib cage, it should bring your spine back to where it's supposed to be. And a lot of times, a lot of the cases, it's going to be based on a pronated foot, meaning that the foot is flat. So when the foot goes flat, okay, your bone completely goes down to that inside part of your the weight, right there, right underneath your foot. So then your hip is going to drop. Okay, so we start strengthening the ankles, the muscles around the ankle, and it's going to bring your hip back into position. Okay, it will take about 3 months or so, depending on the age and what type of trauma you have had in your childhood, if you had some type of injury or something like that.
You probably need some nice, stable shoes to go along with that. Which
Right, exactly.
That's a whole other topic, yeah. Okay, that was awesome. Okay, do you have any expertise in working with shoulder pain?
Yes, like I said, like 30 dislocations on my shoulder. I did my own rehab after the physical therapist. So yeah, like you name it, the joint that you need to work on, I'm gonna help you fix it.
Perfect. Okay, last question. Do you come to us or do we come to you? How does your training work?
So pre-COVID, I will come to you, or you could come to my fitness studio. Now with COVID, I'm trying to be as safe as possible. So you're just meeting my gym.
Perfect. Okay, awesome. I know we went a little bit long, but that was such good information. There's a bunch of comments you'll see in the chat about people sitting up straighter during this talk and being more aware of how they are. So, Raphael, that was amazing. Give him a round of applause, guys.
Thank you.
Thank you.
Yeah, it makes me remind myself that I need to get back into yoga for sure. And Raphael, just thank you so much. If y'all haven't yet met with him, had a one-to-one with him, go see him, have him come see you, and just Raphael, thank you. So that's, again, the speaker portion is the ability to dive deep into why you do what you do, how you got up to do what you do. And if something triggers you to be like, I need to connect with Raphael, just please do on Facebook, through him on the website.